Today we are going to be discussing chronic kidney disease. That's also called CKD for short, chronic kidney disease. Our kidneys are one of the body's most vital organs, essential to life, in addition to the other vital organs such as the heart, the pancreas, the liver, bones, and there's more. When a person has chronic kidney disease, it means that his kidneys have become damaged and they're gradually losing their ability to keep you healthy. So today we're going to learn about risk factors for developing kidney disease, what it is, how to reduce your risk, and the importance of early detection. And you know that I'm a retired nurse. Besides working in the kidney department, nephrology, over at Mercy, I've also worked in hospitals, in medical surgical units, visiting nurse home health care. And I even dabbled a little bit on a research project with the School of Nursing in Madison and the School of Engineering in Milwaukee on studying why nurses' assistants in nursing homes have been getting a lot of back injuries. And that was a study funded by the National Institute of Occupational Health and Safety. So it was a very interesting study. It's supposed to last 1 year, but you can see why things took longer. It took 3 years to complete the study. When I began working in the kidney department, Mercy was just getting ready to open its new outpatient hemodialysis unit. And oddly enough, that was just about the same time that my family, in another state, had learned that my youngest brother had a kidney problem. This was a shock to our family since we had no previous knowledge of any kidney issues in our family on either side. He had kidney cysts, which had caused a decrease in his kidney function. And this eventually led to him needing dialysis. So he did peritoneal dialysis, which is done at home, for several years. And then when the peritoneal membrane was no longer able to provide adequate dialysis, he had to endure a few years of hemodialysis at a dialysis center 3 times a week. The problem was that dialysis center was about 70 miles away from his home, so it was a long treatment back and forth for transportation. And then a miracle happened. In 2005, he received a kidney transplant. And this gift lasted for just under 15 years, which is considerably longer than most transplanted kidneys remain viable. Unfortunately, he did pass away in 2020. Just at the onset of the COVID pandemic. So he was able to have a good life, reasonably comfortable, for about 15 years. As a result of my own personal experiences with chronic kidney disease, along with my clinical work with the kidney patients, I realized that the sooner my patients could learn about chronic kidney disease, the better they might do. And I found that all too often in the office we were seeing patients who were being diagnosed in the later stages of the disease when dialysis or kidney transplant would become necessary. And so it became my goal to try to teach patients what they needed to know so that they could try to forestall that unit. I didn't have too much trouble convincing the dialysis nurses of that either, so we were able to join together. Because it was so tight, I saw patients before they got to their unit, and they got the patients after I had been able to work sometimes with some of them in enough time, so they'd have a better idea. So we joined together, we contacted the Kidney Foundation, and I was looking back through some old records back in 2009 was one of my earliest contacts with the Kidney Foundation. And so along with the National Kidney Foundation here in Wisconsin, and the marketing department at Mercy, we were able to put on educational meetings within the city of Janesville and in Walworth County to try to educate patients on kidney disease and what they should be looking for. So as a result of my goal to educate, we've learned that early detection can save lives and start treatment to hopefully slow the progression of this disease. And just last week when I was out here in town, I had a conversation with a woman who indicated that her uncle was just diagnosed with kidney disease and he's starting dialysis now. So that kind of tells me he might have been in those later stages and was just diagnosed already. Something you should know, 30 million Americans have chronic kidney disease. 1 in 3 persons are not aware that they are at risk for even developing kidney disease because the symptoms can be so gradual that it's often not noticed or often misdiagnosed until the advanced stages when dialysis or kidney transplant is necessary, or sometimes it's not even noticed until you notice it on a death certificate. As a result, this silent disease is now on the top 10. It's number 10 on the top list of causes of death. COVID-19 has also been targeting people with kidney disease and those who are at risk for developing kidney disease. CKD is a worldwide public health problem. No surprise that March is National Kidney Awareness Month in the United States, but during that month in March there is a World Kidney Day, and you can Google that on your computers and find out information on all of these things. In the United States, the incidence and prevalence of kidney disease, kidney failure, are rising, and the outcomes are often not good and the costs are high. The major outcomes of CKD, regardless of the cost, include progression to kidney failure, complications of decreased kidney function, and cardiovascular disease. Unfortunately, CKD is often underdiagnosed and undertreated, resulting in lost opportunities for prevention. And this was a quote from the Annals of Internal Medicine way back in 2003. It still is appropriate today. Over the years, the National Kidney Foundation has worked diligently to define chronic kidney disease, to classify the stages of severity, to provide a common language for communication among healthcare workers, but also with patients and families, investigators, and policymakers, insurance. These things have helped to create and utilize clinical practice guidelines, which have made improvements in the quality for the evaluation, the education, and the management of chronic kidney disease. It is our very own National Kidney Foundation of Wisconsin in Milwaukee that has generously provided all this literature on kidney disease for you today. So do feel free to utilize this information and feel free to contact the organization online or by phone. The National Kidney Foundation is the public health resource for anyone wishing information on chronic kidney disease. And there's little business cards over there from the lady that I talked to. They've always been my #1 go-to first. So, do you know the risk factors for causing kidney disease? The leading cause of kidney disease is diabetes. The second leading cause is high blood pressure. There are other risk factors. People over the age of 60 are more at risk for developing kidney disease. Also, people of ethnicity, African American, Hispanic, American Indian, American Asian, Pacific Islanders. There's a lot of posters here, and so you'll find a lot of this stuff also on the posters. Also, if you have a family member who has a history of kidney disease, high blood pressure, or diabetes, or is a smoker, you may be at risk as well as that family member. Now, as I mentioned, my brother had polycystic kidneys, so there are other causes for kidney failure, and these can include things like autoimmune disorders, connective tissue disorders like systemic lupus, scleroderma, rheumatoid arthritis. There are hereditary diseases that can also cause polycystic kidney disease is one of those type of infections or risk factors. Tumors can sometimes do it, and men over the age of 50 that enlarge prostate, that can be a contributing factor. Exposure to heavy metals or toxic chemicals, use of pain relievers, alcohol, or other drugs can all contribute to declining kidney function. Now, there are 3 types of kidney failure. The first one is acute. That occurs when there's a sudden drop in kidney function, and that's usually from injury because of severe blood loss. It could be drugs, it could be poisons. This could lead to permanent kidney function, loss of kidney function, but if the kidneys haven't been too severely damaged, it may be reversed somewhat, but they still would have a risk factor. The leading cause of kidney failure is, of course, the chronic. That's a gradual loss of the kidney function. This is the most common type of kidney failure and the type we're discussing today. The appearance of protein in the urine may be the first sign of this otherwise silent disease. And then the third category of kidney failure is end-stage renal disease. We call that ESRD. And this is the total end-stage renal disease, which requires dialysis or transplant because there's been permanent loss of kidney function. Does anyone know the symptoms of kidney disease? Well, I'll read a few to you, and you tell me what you think. Increased fatigue, less energy, trouble thinking clearly, poor appetite, trouble sleeping, dry itchy skin, nausea, vomiting, generalized restlessness, muscle cramps at night. Sound like the other stuff?
Right, all kinds of other stuff.
Swollen feet, ankles and hands, puffiness around the eyes, the need to go to the bathroom more often, especially at night, numbness and tingling. So you can see why these things resemble so many other diseases and why they get overlooked. So sometimes it's not until patients start including, experiencing other conditions such as anemia, high blood pressure, bone and mineral disorders, heart and blood vessel problems, or they have a stroke, that the kidneys get looked into further. So that's why it's important to know what to look for, what to do. Now the other thing is there are 5 stages to kidney disease, thanks to the work of the Kidney Foundation and those making these guidelines. It's the stages of kidney disease. Stage 1, and you'll find that behind this little print up here, but it's in every one of these little booklets, in the first page or so, the stages of kidney disease. It's based on what they call estimated glomerular filtration rate. And this test tells how much kidney function you have that's approximately based on a 0 to 100% function. Okay, it helps to determine if you have kidney disease and what stage you might be at. And it's estimated from a blood test, your blood creatinine level. And creatinine is a waste product that shows up in the bloodstream if you have too much. And it's also, in addition to the creatinine, it's based on your age, your body size, and your gender. So if you were to look at your MyChart or your lab results that the doctor would give you and you see creatinine, you'll see underneath it estimated GFR. And that will tell you what percent your kidney stage is at.
Is that an ordinary test that is run if you go in for a
If you go in and
general
they
checkup?
do a kidney panel or any, just not a hemoglobin and hematocrit, but that they do a total chemistry panel, you'll find it there.
Okay,
Metabolic panel, the one they do for your blood.
okay.
She brought her lab work.
I brought my, I went on my chart and printed
So
it.
the stages is stage 1 through 5. And if you're stage 1, kidney damage, protein might be found in the urine, but you might have a normal GFR. It's more than 90 would be your GFR. If you're stage 2, you might have a little more kidney damage and mild decrease in the GFR, and that would be 60 to 89. Stage 3, moderate decrease in GFR, 30 to 59. So like the first 2 stages, you might not be aware of much, but by stage 3, we might be starting to see some of these other complications of chronic kidney disease showing up.
Too late by that time.
Pardon?
It's too late by that time, you should know it's.
Well, but that doesn't always happen.
No, it
And
doesn't.
that's where I like to get people in the office by stage 3 so that you could start to make them aware of what they need to do so they maybe could waylay getting to stage 4 and stage 5.
Excuse me.
When they come in the office,
Can I ask a question? What was that, those initials were GFR, and what was a good value?
well, if you're pretty much normal, you're gonna be more than 90. That's stage 1.
Okay, so if they're lower, what is that, good or bad?
Well, when you get down
What is
to
like 70?
stage 5 at 15, you've got a foot in the dialysis unit or a transplant.
What's about 70?
70 puts you at stage 2.
That's my number.
Okay.
70 or
Yes, but
60.
keep in mind, this is based on your age, body size, and gender. And this is all in your little notebooks there.
That's a
So,
Wow.
so when patients come in the office by stage 4 and stage 5, there's a lot that we're dealing with to try to get them stabilized as far as complications. And the complications, I think I read to you, were things like anemia, high blood pressure, bone and mineral disorders, heart and blood vessel problems. Those are the things you want to try to get under control if those are starting to make their appearance by stage 3. And you definitely want to be working on them at 4.
Definitely.
But stage 4, the GFR then drops down to 15 to 29. And when you're less than 15 or less, then that's when you're in the dialysis unit. You have to have something going on there. Any questions? Does everyone know where your kidneys are located?
They're in there somewhere.
That's a good answer. Well,
Sure, but your tummy button.
your kidneys are kind of located right here,
Yeah.
towards the back. And in your booklets, there should be a diagram. They look like 2 little beans, and they're attached by the renal artery. They go down the aorta, and then up the vena cava. You've got 2 ureters that lead the kidneys down to the bladder, and the bladder's way down at the bottom. They're located in the middle of the abdomen behind your other organisms. They're about the size of your fist. Blood is brought to the kidneys by way of the renal artery. That barely shows it there. And it comes off of the aorta. Each kidney drains through a narrow tube, which is the ureter, down to the bladder. The waste material passes through the ureter and is stored in the bladder as urine. Newly clean blood returns to the bloodstream by way of the renal veins, and after the bladder becomes full, the urine passes out of the body, and that's good. But after the blood enters the kidneys through the renal artery, it goes through a lot of tiny little filters, and we call those nephrons. And these are the actual working parts of the kidney. There's about 1 million nephrons in each kidney. So that GFR tells you how many of those 1 million are working. Each nephron consists of a filtering unit of tiny blood vessels called the glomeruli, glomerulus, and is connected to a tubule. When blood enters the glomerulus, it's filtered, and the remaining fluid passes along the tubule, where chemicals and water are either added to or removed from the filtered fluid, depending on what the body needs. The kidneys do this 24 hours a day, returning about 200 quarts of fluid every 24 hours. So there's a lot going on that you don't see. Okay. What do the kidneys do? They regulate the body's fluid levels. They filter the wastes and toxins from the blood. They release a hormone that helps to regulate blood pressure. They activate a vitamin D, a type of vitamin D, to help maintain your bones in a healthy state. They release a hormone that also directs the production of blood cells. And they help keep the body's minerals like potassium, sodium, and phosphorus all in balance. Okay. At this point, I do have a video that I'd like to show you. And it will explain all of this again, hopefully in detail that you can understand. So I just...
Yeah, I've never learned to run that beast.
Can't go help it.
Donna?
Don't ask me. They changed it all since I used to do it.
Uh-oh, what?
I'll come over and help.
Yeah, please,
Should I pop it out?
You could try that. You could hit eject and then push it back in.
That thing has just stymied half of the people in this
yeah.
church.
Yes.
We need young people.
Yes, and as soon as one person uses it, then the next meeting
that
comes
just
in and they do
means
something
something
else.
Yeah, yeah.
That's what Diane.
Yeah.
One of the reasons we finally given up on videos.
Well, if you push play, it should start.
No, I didn't. Did you get through?
Oh,
Okay, here's you get. Yeah. Oh, good.
In the Elmo, for people living with advanced
Can you
stages
hear
of
that?
chronic kidney disease,
That'll be loud.
free time is precious because much of their extra time is spent in a dialysis unit. In this video, we will talk about how diabetes and high blood pressure are linked to kidney disease. You probably know that you have 2 kidneys. But what do you know about chronic kidney disease? Is that better? CKD, which is the abbreviation for chronic kidney disease, is a silent disease, and you may not even know you have it. Most people have no symptoms until their kidneys are about to stop working. Our kidneys work around the clock to keep us healthy, yet we often take them for granted.
My doctor did a blood test, he did a urine test, and he even actually did an echo of my heart and of my kidneys, and could see that there was massive damage to both of my kidneys. And when he told me that I had kidney failure, I just cried.
Anyone can have chronic kidney disease. Some people have a higher risk. In the United States, the percentage of whites with CKD is 16%. Hispanic and Latino persons with CKD is 19%. And African Americans is 20%.
In the community where I work, 26% of the population has diabetes. And I know that there's other Indian tribes that the rate is even higher, up to 50%. So it's really important for people to get checked for kidney disease and diabetes.
You are at risk of CKD if you have diabetes, high blood pressure, or a parent, brother, or sister with diabetes, high blood pressure, or CKD. As a matter of fact, diabetes and high blood pressure are the 2 leading causes of chronic kidney disease.
It's my family history that out of 3 kids, you know, from my mother and my father, I'm the only one that has diabetes, but I'm not the only one that has high blood pressure.
Both of my parents have a diabetes. My cousin, he uses insulin. My aunt, she's in dialysis. And my uncle, who died by a kidney disease.
Well, most people have 2 kidneys. The kidney's job is to maintain the balance of the body's fluid and electrolytes. It sort of works like a filter for the blood to keep in the things that we do need and to get rid of the things that we don't need. The diabetes and the high blood sugars that go along with poorly controlled diabetes and high blood pressure that goes along with poorly controlled hypertension directly can damage the blood vessels in and around the kidneys, and this can cause kidney disease to progress and the kidney function to decline. Sometimes people are bothered by things like kidney stones or kidney infections. But most problems in the kidney don't cause any symptoms, and people aren't even aware that they have problems until really it's very advanced. Chronic kidney disease has 5 stages. Stages 3 and 4 are advanced kidney disease, but still clinically significant, where people often don't even feel that they have kidney disease or are aware of it. Once they reach stage 5, that's when people generally are undergoing transplantation or dialysis. A lot of people think that drinking water is really healthy for their kidneys. The fact is, drinking water is generally good for your health, but it's not going to help slow the progression of kidney disease from diabetes or hypertension.
I'm diabetic, and I realize that that's a risk factor for chronic kidney disease. And I also know that there are other risk factors out there, like high blood pressure or a family member who has chronic kidney disease. So if you have any of those risk factors, you should contact your healthcare provider.
As healthcare providers, it's important that we communicate with patients the importance of early testing and screening. Because kidney disease doesn't present symptoms until it's a very late stage, finding it early can really help slow down progression of disease.
There are several things you should do. First, get your blood pressure checked regularly. High blood pressure can be a cause of, but also a sign of, chronic kidney disease. At least once a year, get a simple urine test. The test checks for tiny amounts of protein in the urine. This test is called urine microalbumin. A normal result is less than 30 milligrams per gram creatinine. People with diabetes should have this urine test once a year. You also need to get a blood test to check how well your kidneys are filtering. The test measures your serum creatinine and is used to determine your estimated glomerular filtration rate, or estimated GFR. This number tells you and your healthcare provider how well your kidneys are working to get rid of waste from your body. Be sure you know what your numbers are. Ask your healthcare provider what your estimated GFR should be. If you do not have a healthcare provider or insurance, call your local aging department, local public health department, or the National Kidney Foundation for more information. Many people don't know they have chronic kidney disease and have no symptoms until their kidneys stop working. The urine test and the blood test are necessary to detect kidney disease early. Chronic kidney disease is serious. When kidneys fail, a person must go on dialysis or have a kidney transplant to stay alive.
It's very easy to get your kidneys checked by a doctor. All you have to do is go in to have a lab test done, some blood drawn, and then a urine specimen.
If you have diabetes, keep your blood sugars at the level that your healthcare provider recommends for you. Also, have an A1C test done 2 to 4 times a year. This test gives your average blood sugar for the past 2 to 3 months. Try to keep it below 7%. This is a general target. Ask your healthcare provider what your target should be. Keep your blood pressure below 130/80 if you have diabetes, high blood pressure, or CKD. Ask your healthcare provider what a good blood pressure number is for you. You may have to take more than one blood pressure medicine to control your blood pressure. Some blood pressure medicines, called ACE inhibitors, or others called ARBs, also help protect your kidneys. People with diabetes may take these same medicines to help protect their kidneys, even if they don't have high blood pressure.
Since I'm a type 1 diabetic, I know that someday I might need to go on an ACE inhibitor or an ARB to slow the progression of chronic kidney disease, even though I don't have high blood pressure.
If you have a family member with diabetes, high blood pressure, or chronic kidney disease, talk with your healthcare provider about your family history and risk for CKD. Ask what you can do to protect your kidneys and how often you should have the 2 lab tests mentioned earlier. If you have chronic kidney disease, treatment is necessary. CKD will not go away, but treatment may slow down how fast it progresses and may help keep your kidneys healthier longer.
I am looking at the kidney disease more and more, and the more I find out, the more careful I am about everything I do to, one, control my high blood pressure and to control my diabetes. Because those lead, if they're not taken care of or controlled properly, it leads right into kidney disease, and I don't want kidney disease.
It's important for me to be on an ARB because it is going to either prevent or slow the progression of kidney disease, because having diabetes puts me at an increased risk for getting it.
You can also stay healthier by eating less salt, limiting pain medications, maintaining a healthy weight, eating balanced meals in small portions, being physically active each day, stop smoking and using other tobacco products, avoiding secondhand smoke.
Certain medications can damage your kidneys if you take them often or in large amounts. These include things like ibuprofen, Advil, Motrin, naproxen, or Aleve. Ask your healthcare provider if there are other things that you could do to control your pain, and make sure that you tell all your healthcare providers how much pain medications you're taking and how often.
Here are some other things you can do to stay healthy. See a healthcare provider at least once a year and ask about your kidneys. If you have diabetes or high blood pressure, ask how often you need to be seen. Take all medications that are prescribed for you. Never stop taking your blood pressure medicine or take a lower dose than prescribed. If side effects or cost is a problem, talk to your healthcare provider about other choices. Keep a list of all the medicines and the amount you take, and review it with your healthcare provider at each appointment. Include any over-the-counter medicine, vitamins, or supplements you take.
Some medications like ACE inhibitors or angiotensin receptor blockers, sometimes called ARBs, are very important for slowing the progression of kidney disease. Make sure you know when you're supposed to take your medication and how to take it.
I guess if you don't understand something or you're not clear about something with doctors, nurses, anybody that works in the medical field, I guess the best thing to do is to ask. And then even if it seems like a dumb question or something that you're just unsure of, it never hurts to ask again and again, and even get it in writing if you can.
Sometimes we use big words when talking about your health. If you don't understand something, make sure you ask for help. And remember, there are other members of the healthcare team that can help out with this as well. Your social worker, dietitian, nurse, pharmacist, counselor, or diabetes educator.
Please give me an explanation that I can understand, because you went right over my head, and I'm sorry, but I have to know what you said.
Remember, there are things you can do to keep your kidneys working well. If you have diabetes or high blood pressure, talk to your healthcare provider about getting your kidneys checked. If you have a parent, brother, or sister with diabetes, high blood pressure, or CKD, you and other family members have a greater risk of CKD. Talk to your healthcare provider.
Diabetes is a challenging disease to manage, but I know that it's a lot easier to manage my diabetes well now than to have to deal with dialysis or kidney transplants further on down the road. And as time goes on, I've learned how important it is to make sure that I get my kidney tests done annually, because I only have 2 kidneys and I need to make sure that I keep them healthy.
I would tell people that are at a higher risk of getting chronic kidney disease to make sure they take their medication as prescribed, follow any kind of meal plan that the doctor suggests, whether it be low sodium, low protein. Make sure you keep your appointments, go to see your doctor, just take better care of yourself.
Make sure you get help from your healthcare provider. Ask them if there's any kind of medication that can slow down the deterioration, basically, of your kidneys.
Try to seek advice from other people who have kind of been through the experiences already, and because you can learn quite a bit from individuals who have already kind of ran around the track already.
I know my diabetes and high blood pressure could be give me kidney disease, but if I keep my blood sugar where it should be, taking my blood pressure medication and listen to the advice of my healthcare provider, I'm going to keep my kidneys healthy.
Taking the time now for early detection and prevention of CKD may help ensure that you have the time to spend with the ones you love. For more information, please contact the National Kidney Foundation of Wisconsin at 800-543-6393. Wisconsin Diabetes Prevention and Control Program, 608-261-6855. Phone 211 for other services in your local community.
Please share this DVD with your family. If you have diabetes, high blood pressure, or CKD, then your family members are at risk. You can even share the DVD with your friends and neighbors.
All right. Gee, that did the lights too.
You're good.
I hope you found that helpful.
Yes,
Very good, yes.
Okay. Now, tell me what you learned.
Protein is, that plays an important part in it.
When the kidneys are working well, they don't spill protein in the urine.
They don't.
No. It's supposed to keep protein in your body.
So,
The other thing we don't like to see is blood in the urine either. We don't like to see blood and protein, because then it means something's wrong with the kidneys. So that's why urinalysis being done is so important. And your blood test, you need to have that chemical panel done, you know, every so often to make sure whatever the blood sugar is, what the sodium, the potassium, magnesium, what your creatinine is, that GFR,
Yeah.
those are important.
So
That
you're
means you
saying that too much protein is not good for you?
in the urine.
In the urine,
But how do you keep it out of the urine?
well, you have to have kidneys that work.
That's explains it.
So, sometimes as the stages of kidney disease progress, sometimes then we have to work with diet. and sometimes with other medications to keep the, sometimes people develop anemia, so sometimes that has to be treated, as well as sometimes the effects that poor kidney function has on the bone, the minerals that affect the bone, sometimes we have to address that too.
Pain meds, I didn't realize that they were so,
Yeah.
that was a problem.
Yeah, a lot of people don't realize what all these kidneys are doing 24 hours
Yeah.
a day.
Aspirin, how is that?
Aspirin and the medications that they call non-steroidal anti-inflammatories, Motrin, Aleve, ibuprofen, naproxen, meloxicam, there's a whole bunch of them. Orthopedics likes to use them because they make your bones and joints feel so good. The problem is, they feel so good, you use them for so long or so much that it affects the kidneys.
Yeah, even acetaminophen then?
Pardon?
Even acetaminophen then? is bad.
Acetaminophen is more, that's like Tylenol, and that affects more the liver than so much the kidneys. But it's those non-steroidal anti-inflammatory things that make the muscles and bones feel so good.
And what's a safe dose of, I mean, is there a safe dose?
Well,
of,
that's
like,
what
say,
you need to
a
work
couple
out with
Motrin a day or
with your
something?
doctor on what is a good dose. I mean, I've seen people for years, you know, well, one aspirin works, so let's take two. Well, the same thing, you wanna be careful of what you're taking. We're gonna talk now about things you can do.
Okay.
Things to reduce your risk for kidney disease. One is learn your family medical history for kidney disease. Who's got high blood pressure, heart disease, and let your physicians know. And then one suggestion I have is the holidays are coming and families get together during the holidays. And what better time is there to strike up a conversation about what's going on there to see what are your risk factors, what are theirs, and share this information and take pamphlet with you. Plan for those regular checkups with your doctor about high blood pressure, diabetes, and request that a blood and urine test to check for kidney disease. And that one vital test, the glomerular filtration rate, is the test that sees how well your kidneys are filtering. Suggestion, many patients now have access to their lab and x-ray results. In my chart, you do. Monitor your results and ask questions. When you see something, you've got your little charts and those little pamphlets there. You can look now at your lab results and see, how do you compare with that GFR? What is your urinalysis? And then ask your doctor about it. These days with doctors, most people don't have just one doctor anymore. You might see that one doctor, but then you've got 3 to 5 more specialists. And each one of those need to be on board with what your health status is. And you have to be kind of your own advocate now and make sure that you make them aware. I'm going to the bone doctor and I can't take that you're telling me to take because you're gonna have to check with my doctor because my kidneys are affected.
What good is your chart then? Does the doctors ever look at those charts so they know what the other doctors have said?
Well, we have not only the multi-doctors and multi-specialties, but sometimes these specialties might be at Madison, might be in Rockford, might be at Sisters of St. Mary's, might be at Mercy, might be at Mayo. It's up to you to make sure that all of this information somehow gets shared.
That's good. People have to be their own advocate nowadays.
Well, and ever since COVID, there's been shifts in doctors. There's been less physicians for more people, less nursing staff for more people. And so the squeaky wheel gets the grease, you know? It's up to you now to pay attention to these and know what's going on and start squawking. Follow your doctor's instructions to keep your blood pressure and diabetes under control. Try to keep your weight in check. Being overweight can predispose to being a diabetic or having heart disease or other problems associated with kidney disease. So try to follow a balanced diet. And if you need help with that, ask. Ask those medical professionals. Ask to see a dietitian. They're there to help. Exercise helps to control weight and can help alleviate blood pressure. Just ask a patient who's had a heart attack and been to cardiac rehab. I've seen patients in the kidney clinic and check their blood pressure just after they've had their physical therapy for their cardiac rehab, and that blood pressure is usually down. Even 30 minutes a couple times a week is helpful in keeping that blood pressure under control. Consider things if you can't get up and be that physically active, chair yoga or even Tai Chi. They do Tai Chi here. Just be sure to check with your doctor before beginning any exercise program to make sure what is safe for you. And I did mention on there limit salt intake to help control high blood pressure. Do you know how much salt is in our diets these days? Go to a restaurant, it tastes so good because of that salt. Limit your consumption of alcoholic beverage, because that can, and watch large amounts of painkillers, especially the drugs that contain the combination, like Excedrin has caffeine, aspirin, and some other things in it, and those combinations are often associated with increased kidney disease. And this is something I found. It says, it has been observed that a daily dose of 8 to 10 tablets or capsules of acetaminophen alone can damage the kidneys over a 5-year period. That's over a period of time. Studies in animals and humans suggest that combination agents like these can cause damage in even less time. And those non-steroidal anti-inflammatory medicines like Motrin, Aleve, ibuprofen, those can harm the kidneys, but only if the kidneys are already under stress. But you don't want to take too many of them. And dehydration is never a good idea. It's a good idea to keep hydrated, but if you're out in the desert and you're not getting water, overexerting, you're not staying hydrated, those things can stress the kidneys. So do try to drink those 6 to 8 glasses of water a day. Then regarding medicines, never take any medicine without first checking with your doctor or your kidney specialist. And don't hesitate to ask your doctor if you see your lab work going, should I see a kidney doctor? When should I go see a kidney doctor? Stay on top of things. Don't use any over-the-counter medicine or prescriptions from another doctor without first talking with your main doctor or your kidney doctor. Don't hesitate to ask your doctor, other members of your healthcare team, your pharmacist to explain how much and when to take your medicines. And please keep your medicines in their proper containers. When I worked in home health, it was just really difficult because I would find a mixture of different medicines in the same container. And it was like, oh my, do you know how many white pills are tiny and white and look all alike? It's a nightmare trying to figure out what patients are supposed to take. And in clinic, we always preferred when people just took all of their medicines in their prescribed bottles, put them in a bag and bring them to the clinic with you so that we can follow what exactly you're using. And every doctor you would see, whatever specialty, needs to review those medicines and make sure they're on board. And that's not just the prescription medicines, that's including anything that's herbal or over-the-counter, and vitamins, because a lot of those things can be not helpful to what you're trying to do. And make sure that every member on your team, including your dentist, is aware of what medicine you're taking. I think sometimes the dentist is not always kept up to date on what's going on, and that is, in order to get a kidney transplant, you have to be in pretty much as tip-top shape you could be if you're stage 5. But a dental checkup is one of the things that's on their list that you have to complete before you would be getting a transplant. Try to use one pharmacy to fill as many of your prescriptions as you can, and try to get your pharmacist to know who you are, your medicines, so that if you have questions or you have issues with cost, and they can address how and when to take the medicine and facilitate trying to get something for you if it's too costly. Your medicine should be taken about as regularly as you eat a meal or brush your teeth. Forgetting to take your pills is not a good thing. Watch out for the use of those herbal remedies. They may sound good on TV, but they may not always be the best for you. Watch out for the arthritis medicines, because those are the ones we know that can do the most harm to the kidneys. Never, never hesitate to ask questions. You need to understand what you're taking it for, what's it going to do. And those are all things your doctor should be able to answer, and or your pharmacist, or both. Always report side effects. There are many medications that maybe sometimes in combination with what you're using can cause a side effect like dizziness, upset stomach, dry mouth, headache. the doctor, somebody needs to be aware, so get on that phone and report it. Certain chemicals in medicines can cause drug allergies in some people, like a rash or swelling. So make sure that all of your physicians are aware of your allergies and what you're sensitive to. Carry a list of your medicines with you. Whenever you see a doctor, and it's probably not a bad idea, have a list in your purse or your pocket when you're out and about. Utilize those after visit summaries with the list of medicines on the back. It's there for a reason. And just a few words about TV ads. I'm sure you see lots of TV ads. Well, it's always been my bugaboo because one thing is they always talk about the effects of diabetes and heart disease. I've seen very few ads talking about kidney disease in relation to diabetes. And so I would like to see more of that. But just recently, they've had some TV ads on some medications that they're touting for. Have you seen them? Okay. Well, my problem with that is I'm not sure that they're spelling out that those aren't for everybody. Those are advocated only for use for type 2 diabetics with the glomerular filtration rate of less than 45. And that's in hopes of slowing down the progression of the chronic kidney disease to lower their risk for heart disease and having to eventually go on dialysis or have a transplant. And of course, being new, there's probably not all covered by insurance yet. There's lots of side effects listed for those. They're not meant for type 1 diabetics or for polycystic kidney disease patients or those who have a history of using immunosuppressants. So not everything you see on TV is necessarily, I mean, they're out to try to sell their stuff. And it's nice that they have something for some people, but just know they're not for everybody. Is there any questions?
You mentioned my chart. You worked for Mercy. I go to Dean.
They have my chart too.
Yeah, I know. But Dr. Stewart is concerned, who is a nephrologist, about the level of creatine being too high. You mentioned too low was bad.
They use the creatinine level in the blood to come up with this estimated glomerular filtration rate. That's where that is low. The creatinine in the blood it might be up high, yeah.
Yeah.
The higher that is, probably the lower your stage is going to be.
Also, he's very interested in what the bun rate as well as the creatine.
That's another type of blood urea nitrogen, and that is another waste product that shows up in the blood. And quite often, if the creatinine is high, so the BUN is going to be high too.
Okay, thank you.
Probably not what you want to hear.
Well, my trouble is that my creatine and bun have been above the normal range for years and years and years. And all of a sudden he's talking about, well, I think I'd like to have you learn about dialysis.
Well, yeah, that's telling me that your glomerular filtration rate is going down. And it's time, and that's why the more you learn earlier, the better. You notice Janesville now has 3 active, dialysis units. That tells me something there.
Yeah.
There's a greater need.
People have it.
We're living longer, we're getting more diabetes, more high blood pressure, more kidney disease.
I know. Thank you.
Is there anything else? Feel free to look at posters, pick up the,
Yeah, I have a little question. I go to an endocrinologist, and I'm a type 1 diabetic, and autoimmune adult onset type 1 diabetic. Is that an appropriate person to go to? mean, he seems to be really caring about my kidney functions and those
You
things.
can always ask him to see a kidney specialist who specializes in the kidneys. You know,
Yeah,
you might need both,
yeah,
and then they need to work together.
okay.
We worked a lot, the kidneys are so closely tied with so many other things. Our ties were really close with cardiology.
Well, the first thing that they did when the first endocrinologist I went to, immediately put me on blood pressure medicine and,
Did you
statin.
ask him why?
Yes, I said, I don't have high cholesterol and I don't have high blood pressure.
why?
And she says, for your kidneys.
And that's, but that's,
Yes.
did you see in the video?
Yes.
The lady who was diabetic, they sometimes have to take these things to help
Yes.
maintain
And
some
when
of
the
their
young
kidney
man was
functions.
talking about it.
Yeah.
Yes, and that's
Just
interesting,
understand
because
what
we wouldn't
he's
have known that.
No,
So this class is very informative, Jan, you know,
yeah,
because you don't know that. They can say why, but for your kidneys, but you don't know technically why.
no,
And then on the video, at least they talked about why they,
why,
yeah.
yeah.
This is why things like my chart
Mhm.
is so helpful, because you have the
I'll go in there and
opportunity
look.
to participate in and monitor, and don't be afraid to ask your doctor, when should I go see a kidney doctor? What should I be doing? What about my diabetes? You know, have them explain it to you, like they said, in terms you can understand, because it's so easy. They get so wrapped up in their professional life with all those big words that they don't know that the rest of us don't always get it.
Good,
You
yes.
know, so
And it's
don't
nice have-
hesitate to
It's
tell
nice to
them.
have an RN in the family that looks at my chart and says, this is what you need to know. I know.
Yeah, that's.
Advocate.
It can be
Yeah.
a plus, but
Yeah.
yeah, so,
Not only looking at your my chart, and you can print out for the last X number of years.
oh, and that's very helpful to look at,
Yeah.
what
To
is
see
my
what's
kidney function, what is my
starting.
diabetes been? You can go back and you can see that,
Mhm.
and you can take that and say, hey, what are we gonna do?
But in addition to that, at least on the ones we get, I assume it's the same computer program, there's a place at the bottom that asks, take a look at the notes the doctor took, and then
Mm-hmm.
take a look at what he or she says, what I found that.
Yeah, that's a good, interesting thing to find out, isn't it?
Oh, yeah, it's a little scary, but
Yeah. But that keeps you in the loop. Why
Yeah.
shouldn't you be in the loop?
Yes. Yeah, it's true.
The key is trying to get a physician that stays with you. I haven't had a doctor for years and years and years. I have one, or then I have another, or then I have another, and I don't have a doctor.
And then sometimes there's a long wait to get to see a doctor.
Yes.
So what is the
Yes.
alternative then? You end up going to urgent care.
Well, and that's not so good either.
Sometimes that's a way in.
Yeah.
Yes, some-
Yeah.
yeah.
It's sad because this morning I was out at the other church I preached at a couple of months, and woman's had severe anxiety attacks for months, and there isn't a doctor at this Mercy Center that she can get into for one's left and the other's left, and she can't get in for several months. And so it's right. Urgent care sends her to ER every time, and
And that's not always a good idea either, you know, to wait. You had a question?
I had one quick question, and the question is, if you have a Mercy chart, is that transferable where other doctors and other hospitals and other
Oh,
clinics and
yes.
stuff like that will
Yes,
be able
you
to see
can.
it?
My own personal one, I've got, my Mercy chart connects with UW, with Sisters of St. Mary's. You can connect them. There is a way to do that.
But do you have to ask them to do that, or does it
No, you
just?
can do that yourself, right on the my chart thing.
Okay.
And that's a good way to have it, because then when I go to Madison, she can see what's going on
That's
everywhere.
what I was saying, that's the way it should be,
Mhm.
so that the doctors know what you
And you
are
can
saying.
see what all them are saying too now, you know, you can follow your lab work and all those things, but, you know, that gives you the opportunity, you can do your lab work here to see a doctor up there, but that doctor can get those results
I like
either
it
by
because
way of the
I
computer.
can see what my A1C is before I go into the doctor, so I know if he's gonna be mad or not. But so far, so good.
That's important to know.
Yeah.
Ramona, I don't know who your doctors are, but I had, my primary care one is not a nephrologist and not a kidney doctor. She made some changes in my medications. And it happened that the next week I saw my nephrologist, and he said, yeah, I agree with what, I asked him, I said, did you look at this? And he said, yeah, I agree with what she did.
That's good,
So,
that's good.
Yes.
at least my doctor did that, I don't know, but.
At least, yes, because I
I
never
haven't
said
got a
any
doctor
look.
to, well, I do have, but,
You know,
I usually just call the specialist I need, because it's easy quicker than going through 5 different people, and then we finally end up there anyway. But you need a regular doctor too, that you can go in and get your blood work done regularly and stuff like that.
And they should be looking at all the other notes to
Yeah.
really be the central person to.
Right.
And
make
there's
sure
nothing
everything's
wrong with
covered.
saying, you know, can you look at what this doctor, I mean, they generally do that while you're there, they're looking at that.
Especially if you would ask a question, yeah.
But don't be afraid to speak up and ask questions, and if you think you want to do something different, don't hesitate to tell your doctor what would you like to do? How does that, you and he have to come to some kind of agreement on how we're gonna do this plan, you know?
And there's
Are you
nothing-
gonna do what he says, or are you just gonna forget it, you know?
And there's nothing wrong with bringing a friend with you to your appointment too,
No.
because
Right.
4 ears are better than 2.
That's what we've all said, yeah, that's right.
And bring a list.
Yes.
of what you're
well,
gonna
this
talk
is always good.
Yes.
What's the questions? I always leave after I forget something.
Yeah.
It's like,
That's where my chart comes in nice too, because you
Yeah.
can message your doctor right away if you forget something. And you get a better
Although
response.
you find these days, there's a lag in answering back, sometimes even through my chart. Telephone calls have to go through usually the receptionist
Yep.
to the
Yep.
office to get to the person that needs to address it. And then sometimes they may call back, so I mean, that takes time, but I'm finding through my chart too, sometimes it's taking a little bit longer to get an answer back.
It helps if you could talk to the nurse, and a lot of times you do talk to the nurse. And then she can either help you, or she can nudge the doctor to get back to you.
Yeah.
Yeah.
The other thing about the phone calls is that those are supposed to also be logged in your MyChart. So on your, because I work for Mercy, so when I look at all of the encounters someone has had, those telephone calls are in there as well. So if it has to do with what I'm seeing a person for, I can look back and say, oh, this is the conversations that have happened. So even if you're not sure if it's important enough to make an appointment, or you can't get in for a while, or whatever, there's a document of when you started feeling that, or what was said, and how that you can, it's trackable. So, you know, even if you're going, I don't know if I should really go to the doctor for this, call them. They'll tell you if you need to come in, but at least there's a document on a certain date that indicates when that thing started for you, or whatever it is that you're doing.
Yeah, I didn't know that.
Yep. And you can see it in your MyChart too. So if they didn't make the note,
That's right.
you know, sometimes they get busy and that they haven't gotten it, so if they never make the note, call back. Hey, I didn't see this, you know, I need that document. So.
That's interesting.
Okay. Anything else? All right. Hope you learned what you needed today.
Yeah.
Very informative.
And feel free, we have, you know, as much time as you want. Spend time looking at the posters and the charts and taking pictures of things, and take as many brochures as
If
you
you want
want.
something fun to do. Just open one of these. Did you open one yet?
No, not yet.
Oh, well, let me show you. I opened one and got the surprise, a surprise that I didn't expect.
Whoa, it takes off. That's what happens. So be careful.
So if you have youngsters that might have fun with this, feel free. They were very generous in what they sent.
I think we should give her Janet.